everyone, and happy Friday. Today we're going to talk a little bit about kidney disease and a low-carb, high-fat diet. I get this question all the time. If I have kidney disease, is this something that's safe for me? Why is this such a common question? Because diabetes-related kidney disease is the single most common kind of kidney disease in this country. The biggest reason for kidney transplants being needed. So a lot of people who are interested in controlling their diabetes with a low-carb, high-fat diet also have this secondary problem. So let's talk about it today. So the concern that could be raised for a low-carb, high-fat diet is that there's concern that patients with kidney disease shouldn't be consuming a high-protein diet. So why isn't this a concern for patients with kidney disease? There's two reasons. The first reason is, remember, a well-formulated low-carb, high-fat diet is not high protein. So, first of all, this concern is not valid to begin with. Second of all, the studies on this are very inconclusive, even if it was a high-protein diet. But let's just get the most important facts straight, and that is low-carb, high-fat diets are not high protein. So, they can be used safely and effectively in patients with kidney disease. In fact, I would argue, again, going back to the biggest problem with kidney disease, being diabetes, that a low-carb, high-fat diet is the perfect nutrition plan for someone suffering with kidney disease. Now, the question then becomes, is there hope that kidney disease or diabetic nephropathy could reverse with a low-carb, high-fat diet? We do not have good studies on this. So what I tell my patients all the time is this. Look, I can tell you that your disease will not get worse because of eating a low-carb, high-fat diet. And there's a really good chance that we can stop the progression of kidney disease, and in many cases in my practice, we see disease reversal. However, it's not in everyone. And when I say disease reversal, again, I'm talking about reversal of diabetic nephropathy. So I want to very clearly state, we do not have enough evidence that it's going to reverse the disease. I can tell you anecdotally, in my practice, we have seen many cases of reversal. I can't prove that the diet is the cause of it, but again, that's the thing that's changed. And why do we think that maybe it's the diet itself and not just the fact that their blood sugars are well controlled? Because we don't have any evidence that a tight control of diabetes or blood sugars results in nephropathy reversal. There was a nice study done on this. However, the limitations of the study on diabetic nephropathy was on rodents. So of course, it's got its limitations when we try to transfer that to humans. But a low-carb, high-fat diet in rodents was shown to reverse diabetic nephropathy. Now, we really hope that there's going to be more studies to come on this so we can say with certainty. In fact, our small study, the pilot study that we did in our department, showed a significant decrease in creatinine, meaning an improvement in kidney function, on the patients on a low-carb, high-fat diet. Again, this was a small study, so I want to be very clear. Low-carb, high-fat diets are safe for people with kidney disease. We don't have the evidence yet to say that it's going to improve the kidney disease, but I think there's a lot of hope for this, and certainly we're going to be looking at that further in the trial that's ongoing in our department right now. So hold tight. Hopefully we'll have a better answer for you again in 2 years or so when our data is finished. So let's just recap again. Kidney disease, you want to try a low-carb, high-fat diet? Do it. It's certainly going to help control your diabetes and control your weight. Both big factors contributing to kidney disease. Will it reverse or improve the kidney disease itself? It might, but we certainly can't say that it will for sure. So I hope that clears up some questions that people have had with a low-carb, high-fat diet and kidney disease. Thanks again for tuning in, and we'll see you, actually I won't see you next Friday. I'm going to be at the American Society of Bariatric Physician Conference in DC, but tune in again the Friday after that and we'll be back. Thanks again. Have a great day.